So as a chartered physiotherapist of 41 years and a medical professional, I have worked in the NHS and also setting up my own physiotherapy and Pilates centre, which I had for 30 years. And I've worked with some wonderful medical professionals, consultants, orthopaedics, neurology, all different multidisciplinary members of the team. And some of them have had a very holistic approach to the care of their patients. But we still have an NHS and a medical system where lifestyle is not brought into the conversation. And I think we are doing such a disservice to patients to not enable them to understand the power of bringing about lifestyle change with all medical conditions. And it's not to say that a medical doctor can bring that about, but they have to impart that information alongside medical intervention if it is necessary, and to give the patient the power and some ownership of their condition. And when I talk about lifestyle, it is the 5 pillars of health. It is understanding the power of good exercise, appropriate exercise for you, not doing too much exercise, not doing too little. You can over-exercise, you can be too fit. Eating well, eating nutritionally healthy food, sleeping well, working on your mental fitness. And that will come into play when you're dealing with medical people. If they are not allaying your fears during those medical consultations, then that is going to add to your stress and discomfort. And then really the power of friendship, community, connectivity, and one's family and interacting with that. Now, that's not to say that this is going to affect every single medical condition, but the majority of them, these are the things that individuals can do. And I'm being contacted a lot by people I know, people who attend my classes, just wanting advice on how they approach their medical consultations. And my advice is you have to go in feeling that that medical person, their main role is to allay your fears, to explain your condition, to give you advice and guidance, bring in any medical interventions, and give you the option to be able to communicate with them and decide whether that's the right route for you to go down with the knowledge that they're imparting. But so many medical people will just tell you what they think is going on. They will then give you a drug or a treatment and you're not really involved in it. And too many people just accept it. And I don't think that's good enough. I think every medical professional should be able to diagnose well, bring in appropriate lifestyle choices and changes that can be made that will influence the condition that you've got, and allay your fears. So you have to go into that session with a list of questions and don't take no for an answer in the politest possible way. But you've got to leave that consultation feeling that your concerns and your fears have been allayed. And that certainly was what I aimed to do at my Westminster Physiotherapy and Pilates Centre, which I've now sold. And all my colleagues that worked within that practice, it was paramount to our care of our patients. And I don't think it's happening. I know it's not happening, to be honest. I know it's not happening. And it's not good enough. And I think, once more, we've got to work from the bottom up, and that you have to, in a polite way, if a doctor, a GP, a consultant is not allaying your fears and giving you enough time to really understand what's going on, you have to confront the situation and say, I'm so sorry, but I'm really not fully understanding. I'm still concerned about this, and you should get full resolution. And that is a good consultant. That is a good chartered physiotherapist. So I hope that information is helpful, and take an advocate with you, because sometimes in that situation you feel rushed, you feel you have to be, you can't ask all those questions, but you need to be reminded with the person who's come with you too. So give it a go.